Hi, it's Michelle from Movement Lesson, the place that you come to help your child move better. Please join me now watching some Facebook Lives. What I do during my Facebook Live is I try to do a weekly video review. If you join my group, Movement Lesson for Parents and Practitioners, in that group you get to submit your videos and I review them to start guiding you on where you can go to help your child with their movements, with their visions, combinations thereof. So please subscribe so you can be in the loop to get all of my videos. And let's start with Facebook Live. Thanks.
Ready.
She doesn't know how to count. How are you guys? Sorry we had to do a two-part live. We just got a lot of babies. Last week we've started segment 2 and 4. More and more as you get involved with Movement Lesson as you need because of what's going on with the whole virus. We're putting all of Movement Lesson training online. So we finished segment 1, segment 2. We're going into segment 3 in July. However, you can get ready. It will be starting up again in August. I'll have a whole new website up, hopefully by this weekend, new dates and all that to start directing you better. We are going to be putting together a course on rolling over, starting with milestone courses, and the big cranial course is coming out also in July. And that's huge. The cranial course is probably going to be about 5 courses, starting off with the head and the sutures. Is the first big main course to go with it. Then we'll go into the nasal sinuses, then into the palate, muscle-based structures of the head, trauma-based structures of the head, and so on. So with that, Priyanka, I know you want so much for your baby to thrive. And I know you're doing a video just to help me get you the information that you need. However, your child does not know the basics like lying down. We need to settle his system. He needs help with his vision, so there needs to be some vision that you're working on. You need to help him with his lying down. I know he's almost a year. However, to help your touch, right? Because he's just settling, and you're throwing him. And I know you're trying to get him to go on his tummy and all of those kind of things that you think you need for him. But basically, and again, I'm just talking about just this video. It's like being a frog in the blender. We need to start matching up his movements with his vision, right? And to settle his system. So you're going to go after that spine and pelvis, but I would like you to start with my newborn movement assessment. It'll give you a better idea how to evaluate your son and to see where you need to work on, but it's really going to help your touch, right? When you're touching, like if I want to see you, right, my touch has to be so much here with the functional movement versus, again, see what it's going to take for me to move my eyes around with that is just a very hard circumstances. So that's where when I said, please, no, don't do this, but and I know you just want a nice successful video to help me, but we want to help your son. That's our main priority. We need to settle down a system. So you're going to start with a newborn assessment, and then also in the link below, I'm going to offer, I have these like good 10 baby videos just to settle his spine, start working with those movements. But please start with the newborn movement assessment first, just to get your touch down and move into that. Thank you. Another thing that you can also do, I have a great boot camp that would help and help you use my videos better is another option for you. Denise, thank you. I'm sorry that, I hope you didn't mind that I was asking about charge. There's a lot of similarities, as you would know. And so, again, the way that certain genetics are, I did look up the condition, and I get it that there are issues with the head shape features. Not a problem. What we need to do is to tease her, first of all, as if her eyes are lined up. When you do have a larger cranial and it's a pull, again, my eye proportions should be here, and she's a bit wider in between the eyes. But what happens is now I've got to see with my right eye and my left eye. So it's more so than a CVI kind of thing. I really need to know that the structure's okay, meaning glasses are not needed, because again, let's say if your eye was nearsighted and farsighted, and then I'm going to look with my right eye to see close and my left eye to see far. which again is gonna throw balance to the wind. So what's looked at as a lot of low tone is again, she's not in a position to say, oh, this is an apple or these are my fingers, right? So everything that she needs to do, she's doing to stabilize where her vision is at, right? So not that I can recommend patching, and I know patching is looked at to strengthen the eye. It's not about eye strength, it's about stimulating the eye. So I wouldn't say that you need patching, but what I would say is I would somehow where you can work with covering, because I can't suggest patching when the doctor says it. So I'm not looking to do a 6-month patching program. This is strictly to do a visual evaluation, help your daughter. I can probably tell you more on a Zoom though as well, to give you more detail, but you're going to want to see where this eye is happy seeing, which I have a feeling the eye, because of the shape of the head, is more here versus, let's say, here and here, right? So what you're seeing is a more happy vision here, which technically would be exotropia, but in her case, it's not that the eyes are drifting out, it's the shape of her cranium is shifting out, right? And so she has to go and look at that, which again is going to give her balance issues and seeing more and more tone issues. But again, it's hard to get a whole midline strike for me to keep my eye on the prize if I'm literally like here and here trying to do that. So we need to tease her vision and bring it straight. It's going to require a bit more work, but again, it's a game plan, right? So I'm not trying to say, but so we need to see where the eyes want to focus, and again, hopefully it's about here. And now we want to start drawing that vision from here to here, right? And then to get to that midline. And then I think too, that will help you with all of that, and connecting up now the eyes with the sternum would be your next step. Rebecca. Okay. It's very easy for someone to want to jump in and talk about development. However, your child had open heart surgery. I know you've been through a lot, and he's been through a lot. The open heart surgery is a little bit different. Now, what people don't realize with open heart surgery is, first of all, and I don't mean to get so graphic, but I know you've been through it, I'm just trying to help. But with the open heart surgery, not only are they pulling the chest out, but they have to drop the head back here during surgery to get the chest to be wider. So we need to get in there first of all, and I do have a really good course on the head and the vision to work on the head. Now I also have a free video, and it's an old one, but another thing what people don't realize, and this is where I'd like some information, if they wired the chest shut or they're just working with the scar tissue is coming together, but it's very early. The scar tissue of the chest is going to come before the calcification. So where does that come into play? When I go to crawl and do things, my spine and my rib cage counter. This way is this way. Most people look at every movement side to side, but if I'm crawling, right, or I'm climbing, all of these kind of things, see where my chest goes. Well, we've interrupted that process due to the open heart surgery. I would get in there, oh, so soft. He could be snuggling in your arms, and you're just, the first thing you need to do is get in that minor rotations, but very major, from sternum to sternum to get that, again, even crossing midline. Now, this is so gentle, you can do it on yourself first. I'm not looking to, get in there, right? It's still with that gentle touch, but that's the head control, what you're looking for. That's the head control. If he's here, and especially when that scar tissue is coming in, especially if his shoulders went too tight with it, which can happen, or too wide with it, which can happen. Again, I've had clients in both situations, as well as our shoulders should come in a little bit, and sometimes with the scar tissuing, like if you're laying back, the shoulders just go wide. You'll see that when the elbows start to come in. So these are just things. Right now, the first thing we have to go after is, in a sense, not only healing the heart surgery, which has been healed physically, we have to heal it movement-wise. So he needs to not only cross the midline, but he needs to get that rotation in the sternum back. Once we're done pre-operative or post-operative care, Then we can start working on the spine crossing midline and then going into his pubic bone strike. But he's not gonna be able to get a pubic bone strike, right, if that chest can't open up in that sense. So depending on where you are post-operative care, like I don't wanna go, if your doctor says, again, no torque, no rotation, which is great, that's what heals the sternum, but you can't do a milestone without torque or rotation. So I don't want him to lose out on now his movement into the milestones that he needs to do. And with that, with the vision, but I really would go after that sternum first. If you can just let me know where he is, if we can start working on this, but please don't do anything that your doctors, again, has still advised you maybe for post-operative, because I just didn't write that part down. And I don't wanna say, oh, start doing this when he's only, let's say, 4-week post-op. So thanks with that.
Okay.
Ketrona, I hope I'm saying this right, guys, sometimes. Now, there's two things that's going on. So, first of all, there was a thing about patching. I'm all for patching. Now, the reason I asked what type of patching, so I do have a patching course if you're already patching. This is not the type of situation where you patch and say, see you later, the doctor said patch for 2 hours. When you patch, we have to find vision, right? He's a baby. So this is where it's confusing, where people see, oh, don't patch so early. Well, if I want to roll over, sorry, I'm going to need you. When I say I need you, Betsy helps with the camera. So when I want to go roll over, right, I have my eye on the prize. There's my camera. I want, and that's what rolls me over. When I have an eye coming in and so forth, first of all, I don't see the camera, right? It's very hard when you have an eye out of alignment, your convergence is off, but also it brings your vision to about here. So no baby is going to roll over looking at something. This is where you start calling me up, saying my arms are stuck, my arms are like this. But again, it's that vision. See, again, because I can't watch you anymore because that's where my convergent point is. So when I'm patching, I want to go in and bring out that, not only to the vision into the center, but now also where the vision has to go into movement, right? So it's not just about making the eyes straight or okay, we have to go into movement or in and out of movement. So if I'm watching you and I can come here and I can come here, right? When a baby is developing, it's all developing around their vision. That's what makes them want to walk, because they want that ball, right? So what another thing is, you got a great kiddo. He's a chunky monkey. I hope you don't mind me saying that, but I had thick thigh boys, and they're, but if you look at his proportion is a little bit off. The size of his head compared to the rest of his body. Now again, I'm just saying that, but I'm saying that is structure for movement. For him to go to learn to sit up and so forth, what we need to start working with or rolling over is normally the proportions are more even, size of the head to the size of our butt. It changes as we age, but that's where it is. And that's what gets your proportion. But with his head being just a tad smaller, I'm just going to show you my head off the edge just to show you where that gets me. My eye, I'm going to want to turn, but I don't have the same momentum, and now my eyes are in, to get the roll to happen. And that's where it affects development. So when you're playing with him or working with movement lesson, this is where you want to change where his head proportions are just a little bit so they match with his thigh. And this might be something more where we want to work on with a zoom, because again, it's not that you're holding the head, because now I lose my vision, right? But that's where you want to get for its more proportion, and again, where you're sitting up can come into play. Versus that I'm down here, and see if my head's down this way, there's no way I can't sit up. I just don't have I would need to have, again, contrast, which your baby doesn't have, to sit here and push up because I don't have it. Just this little bit, change shift of that, I can come right up to sitting. So that's what I mean by proportions. I'm not saying the baby is off, but with the little guys that are a little bit bigger, which is fine, you have to keep that in mind when you're looking for development. So between that and the vision, that's where I would go after. Okay. Becca, I'm working with you and I'm looking for a what I call as a pubic bone strike. Okay? It's very easy to say my baby is not lifting their head, right? But babies don't lift their head. They strike their pubic bone and that's what brings their head up. I'll lie down to show you. When a baby, it hasn't gone into that, so I can tell you right now where you need to go back to is he doesn't even know he can lie down properly, and the rolling over was a problem, and also going into if he's at the age to even grab his feet is just not happening. Grabbing the feet would happen around 4.5 months as far as my scale goes. So he's down, and so with that too, the head is too heavy. There was the next one.
The next one.
Look at Alyssa's now. I don't have a vision shot with your son, so you can post that and I can review it again on next week's live to see if again if the vision's coming in, that's where too it's going to be hard to come into that pubic bone strike. So what I'm looking for with that, right? When you're here, when that tush is up, see where my head is? And you're expecting him to plank, right? And then somehow with this, lift his head up. Now the reason babies don't do that is because when I'm in this position, I can't play. If I go and see a ball or even attempt to see a ball, right? I'm not in a neutral position. My butt's up, I'm off my elbows, and if I go to even look at something, I'm gonna fall down. Right, and then this is where it's fat because he can't roll over. His arm's gonna get stuck, and he'll start crying, and he's in distress. Right now, if I have a pubic bone strike, I'm here. Now I'm free. I can do my airplane, and I'm that, and see my vision is free. Right, so I don't know if his hang up is the vision, or that we have to work on the pubic bone strike. If you go up to the corner in your Facebook group here with me, the movement lesson group. You'll see units, and there's a unit on the pubic bone strike. I would also really like you to go back to my newborn movement assessment just for you to address where he's breaking down on his milestones. And then I have free baby videos, and those are going to be linked below. But that will really refine your touch and give you more direction of where you can help him. So Alyssa, okay. I know you're going through a lot. What I'd like to do, very similar to what I was talking about with Rebecca's child with open heart surgery. Your child had cataract surgery, right? Totally necessary to do. But what happens with surgery, especially post-operative care, first of all, you have inflammation. Again, that's just going to happen with surgery. You're also going to have patching gauze around the, most likely. What this does is it tilts the head over to being too heavy, right? So I know you have the microcephaly with this and so forth, but what the problem is, and I have a great course on the head and the vision. We need to bring the balance back in the head to, in a sense, get rid of what happened with the cataract surgery. Because that inflammation that happened in his tear ducts around the surgery and all that, even if it was just temporary, what happens is when a child finds a movement difficult, right, or hurts them, it's the same thing. They won't do the movement, right? So when he's in this position and so forth, again, too, the vision wasn't turned on to scan and come up. That head is just not going to come up. I really would look at that one first. From there, right, because we've just got to balance his head out. If I see him on his back, again, I can tell you exactly what's going on. But no matter what you're doing with him, you're seeing this kind of thing. That's just the head being too heavy. And it should be countering through the pelvis, right? And none of that setting up, because again, I'm trying to lift, now I can't see you, and those are where you're having the developmental issues that a baby cannot counter on their own. Right? If I start doing those things, I go, oh, whoa, I need to sit down, right? I have compensation skills. I can't talk, but I have compensation skills. Babies don't, right? So we have to balance out the head, not making his heavy. We've got to, in a sense, get the complications of surgery out of him, because again, this was something he woke up and he was like, where am I? And he hasn't gotten past that point. I really would like you to look at the head and the vision, and then the spine and some pelvis work with him for crossing midline and getting back to neutral, because this has not kicked in. It's more of the heaviness. Leah, first of all, I'm not a doctor, I just play one on TV. I understand your concerns. I get it that the EEG came back normal, but as you know, as an OT, that still could be, but the EEG came back normal. You have a right to look at Stuyvesant's, but I don't know if he's been scoped yet, meaning by an ENT. I get it, we're under this quarantine stuff and it stinks. He actually can have two, as well as if the palate shape is just a little bit altered, or the adenoids, tonsils, or more so Micromalacia is just a bit enlarged, and that snorking, good word, snork, that, he's positioning himself, especially if you're seeing this more with eating. It does reflect his reflux, but actually he could just be a little bit of the overgrowth within the valve, or within, with the Micromalacia, or adenoids, where he literally has to suddenly, if he's drinking, and I don't know if you've ever done it, do you ever get milk up your nose, that kind of stuff, or you've been in the ocean and the water just hits you and you're just, that's what my arms do, right? So you might be thinking of a more reflux coming from the stomach, which again still has to be ruled out, possibly again even a hiatal hernia, but I have a feeling something's up where he's more so nasal refluxing, and you're getting more of that. So either that it's tucking up around or the adenoids are just a little bit enlarged, and he's got to catch himself. But again, you would have compensation skills. He doesn't. He's trying to eat and drink his bottle, and he gets to a point, and that's what he has to do to breathe it out. So I agree with you, but I would probably more so find a good ornithologist and see again that he scopes, but all the way just to make sure it's not a valve issue. I don't think it's like a Malaysia, but I have a feeling something's up with either he's got a deviated septum or adenoids, and that's just enough where it's causing either pressure in here or something like that. I'd just like to rule that out. Push Pajali. I hope I'm saying that right. Okay. Now I get it that you have BWS, and that's fine. I've actually said this a lot today, and I hope you're looking at the live. Her eye structure is too wide in the head. Again, my proportions for my eyes should be the same. And as you can see, hers widen out. Now, I can sing this to you because I would assume you're not in the U.S. Again, I'm not looking for full-on patching stuff, and this is where, again, you were told she's got CVI, and it is a processing disorder, but it's based off of structure, I believe. I would like you to lightly patch just enough. Again, we're looking for eye characteristics, meaning where does the eye want to see? So again, if I were to patch, you would see my eyes come straight, and I could follow the object. Where you're getting the tilt, first of all, I would like her eyes looked at again. I have a feeling she's eye dominant, or she can really only see comfortably with the one eye as she's mobile. So what she's doing, it's more like a cyclops. So instead of like this, because see, with the eyes so far apart, like this, I don't have convergence. So she's just wondering, she tilts her head, and you all can do this. So here, see how I can see you with both eyes, but if I tilt my head, what I'm actually doing is like a nasal patching. So I'm actually patching with so my one eye is not seeing, but my other eye can see where it's going. Because I think if you lightly patched her, her vision's not here, her vision's more here. Because of the way the head shape is just broadening her eyes out. Almost like the way, I hate to say this, but the way birds use their vision, right? That they're not getting the binocular vision, it's coming across. So she's actually tilting and becoming like this. So I think in her case, a light patching light patching, I would look at that structure again, because I know you have something with the corpus callosum, but to see which eye really wants to see not only close, but that far. And this is where you're having a lot of the balance issues, because again, she's not using her both eyes to her best ability. I'm looking for patching in her case to strengthen the eye and to excite the eye, because the more and more that she does that, I'm a little bit concerned that she's going to start forgetting the one eye, and which happens when the eye is usually crossed. But in her case, it's like she has a structural exotropia, so the eyes are away from each other, right? They'll never converge. So I can either see you here or I can see you here. But this is where she's just found, either because she's the one-eyed hand dominant, and this is just easier for her. But I don't want her to turn off the other side of her body. And that's where I would go, I think, for a lot of the skills that you're looking for. Because again, here I can do midline. Here I can't, right? I either have to do this or I have to do this. But bringing my hands together here is very difficult with someone with those kind of visual issues, and that's where I would go with that. Guys, thank you for the double lives. See, look at that. We did hours of lives today. I am still involved in the segment 2, segment 4 training. I will be picking up the lives now on a weekly basis again, because my next training for cranial and going into segment 3 is not until July. So I have more time to devote to you guys. We are working on, obviously, new courses as quickly as we can, because thanks to the quarantine, as you're realizing too, which I've been telling you, our kids are really, and I see it more and more, where not only they're not getting therapy, they're starting to regress because of the information that's out there. I'm trying to make the information relevant for your child. I'm starting to create courses that are more milestone based, making that easier for you to help your child, right? This is what Movement Lesson has to offer. We've got YouTube, it's free, right? But it's YouTube. There's search engines that you can use and go through it. We're updating playlists and trying to get it. Then I have my subscription site where I break it down on body part. Working with an adult video is just as important and will help your child as working with a child video, right? But with that too, now we've created courses. I've got courses on speech, swallowing, vision, patching. There's courses out there, constipation. And so there's so much that Movement Lesson has to offer you. The boot camp can be purchased to help you and help your child, right? If you're not getting the information that you need from us, by all means, post your videos, and so we can direct you to help you get the help that your child needs, because what they need is better movement, and that's what we're after. So thank you for the 2 lives, and I will see you in a little bit.